Welcome to Healthy Choices After Transplant, brought to you by the American Society of Transplantation and Kidney-Pancreas Community of Practice. I'm Ron Parsons, a transplant surgeon, and I have 5 other experts in transplantation here to talk about a few fact or fiction questions and talk about healthy choices after transplant. Their names are Doctors Singh, Yadav, Nishio Lukar, Riyadh, and Nidahouse. Dr. Silke Nidahouse is actually a transplant recipient herself, and she'll be providing some extra insight here. Why don't we get started?
After transplant, I feel like my body can handle anything, including cigarettes, drugs, and alcohol. Dr. Yadav, what do you think?
That's a false statement, Silky, because all the recreational drugs before or after are not good for health and should be avoided. They can change how the medications are processed in the body, especially after transplant.
All right, and it's probably a smart idea to stay away from illicit substances anyway.
Absolutely. So first, talking about smoking and vaping, they can injure your kidney, your blood vessels, your lungs. And if you need a second transplant, it would be really difficult to get them. So please avoid smoking and vaping.
And it's true, as a surgeon, I've seen some really rock hard blood vessels just from smoking.
I'm sure you have, Silky. When we talk about alcohol, liver transplant recipients should completely avoid using alcohol. Otherwise, you can have one drink for special occasions. That's probably okay, but moderation is the key here.
Absolutely. If you have to drink, drink in moderation, or just don't drink at all.
When we talk about marijuana, nowadays marijuana is legal in many states. So a lot of our patients are doing it, but we should avoid it completely. If someone is on marijuana for medical reasons or was using regularly before the transplant, please talk to your transplant team before you restart using marijuana after the transplant. From the infection point of view, edible marijuana is probably a better one compared to inhaling or smoking ones.
And I agree, good communication with your team about those types of issues is absolutely key. Fact or fiction number 2. Using gloves is as good as hand washing or hand sanitizing. Dr. Nishio Lukar, what do you think?
Well, Silky, that is not true. Washing your hands with soap and water is the single most important step that you can actually take to control most illnesses. And this is super important after getting an organ transplant. To make sure that your hands are adequately washed, you should wrap all hand surfaces with soap and running water for at least 20 seconds.
All right, then 20 seconds seems like a long time, but in surgery, sometimes we have to wash our hands for a full 2 minutes. So you can do 20 seconds.
That's right, that's a lot longer. Using disposable gloves is a good idea when cleaning or disinfecting an area around somebody who is sick, or when in contact with blood, stool, or some other body fluid. However, improper use of gloves can actually spread illnesses, and disposable gloves should never be disinfected or reused.
Yeah, I don't reuse my gloves after surgery. Do you, Ron?
Absolutely not. Bad idea.
And gels or hand sanitizers should only be used whenever soap and running water are not available. Please remember to regularly wash your hands with soap and water for 20 seconds or use hand sanitizers that have at least 60% alcohol.
And just a reminder, 20 seconds is singing happy birthday twice. Fact or fiction number 3. I may not be able to exercise, have sex, or have children after transplant. Dr. Singh, what do you think?
So that's not true. It's a common myth that exercise may injure the transplant kidney or may cause the wound site to open up. This is highly unlikely. In general, patients are encouraged to start walking soon after transplant and are usually allowed to lift up to 5 to 7 pounds of weight in the first 6 to 8 weeks. Afterwards, it is recommended that patients participate in minimum 30 minutes of moderate exercise, some sports, yoga, or even dance at least 5 days a week. In fact, several patients who have had a transplant participate in the US or the World Transplant Games held every 2 years.
And I've had the honor to do that a few times over. So the next Transplant Games are San Diego 2022. We hope we can gather safely by then.
Great job, Silky.
Looks like you got some real skills there, Dr. Nita House.
Yeah, I try.
So another common myth is that sexual activity may harm the transplant kidney, but that is not true either. Sex life is often better after a transplant than on dialysis, but wait for at least 4 to 6 weeks after a transplant to have sexual intercourse.
And when you do, remember to use a condom. It is a good form of birth control for women and also keeps everyone from catching additional sexually transmitted infections.
Next, coming to pregnancy, your chance of getting pregnant may return quickly after a transplant, but women must wait at least a year before getting pregnant.
And it's a good idea before you think about pregnancy to talk to your team so that your medications can be adjusted. Fact or fiction number 4. If I have a transplant, my risk of complications from COVID-19 is higher. Dr. Riyad, really?
Yes, it is true. The risk of severe complication, including death, is higher after transplantation in the settings of COVID.
So what can we do?
So there are a few things that we can do to keep the risk low. Frequent hand washing, avoiding touching our faces and noses, avoiding crowded places, and keeping our distance 6 feet or more, and above all, wearing a mask. Wear a mask like your life depends on it.
All right, I can do that.
And now that we have the vaccine, it is recommended for all to receive the vaccine, including transplant recipients. And we all got ours.
Yeah, and I'm a transplant patient, so I did get my vaccine.
That's
Now,
awesome.
after our vaccine, do we still have to wear masks?
Absolutely, Dr. Nita House. Wear a mask. I like to double bag it sometimes.
And I like to make double sure that it covers my nose and my mouth.
All right, thank you for watching. Healthy choices after transplant. Stay safe out there, everyone.